Good afternoon, everybody. My name is Torin. I'm one of the PTs here at the Hruska Clinic, and I wanted to show you guys today a quick thing for hip bursitis. It's spring. Hopefully, we're getting out and being able to walk more. Typically, every spring, I get a couple of patients that come in and they say, "Man, I really would like to get out and walk. I just can't. My hip is killing me every time I walk. I get this pain," and they'll get right over the top of the hip and they'll have a nasty bursitis, which is just inflammation over the top of the hip. Happens just about every spring. I get a couple of cases of it. And what's the best thing to get back in shape in the spring is get out and walk. We want you to get out and walk. So when you can, it really isn't a good situation. Often people will Google or they'll go to therapy and they'll say, well, that IT band on the outside hip is tight. We need to do some stretching to get the hip to stretch out. We need to do some foam rolling to get that out. And often it can feel good, but it doesn't seem to last when they get out and walk. Or they'll be on an anti-inflammatory, which helps them get rid of pain, but they can't get off the anti-inflammatory. As long as they take it, they're fine, but they just can't get off of it. So all those good treatments are helpful, but they're not really taking care of the problem. And the problem is usually that as they start to walk, they're unable to get their center of gravity over their left hip. So every step they take, there's strain on that bursa on the outside of that left hip. Just a stretching exercise or some anti-inflammatory isn't going to take care of that. So one easy thing that we would do would be to look at what muscles need to get a little bit more active to help you get your center of gravity over to your left side. And a major one is actually your left hamstring. So anything that we can do that would over-engage or help you learn how to re-engage your left hamstring will help you get your center of gravity to shift to the left a little bit better. So an easy thing that you could try at home would be what we would call a 90-90 hemi-bridge. 90-90 refers to the position of your knees and your hips as you position yourself on your back with your feet up on the wall. A hip lift is when we would utilize your hamstring muscles to engage to do a little bit of a pelvic tilt. So all I'm doing is digging my heels down into the wall or into a chair if your feet are up on a chair. Tuck your tailbone up, and if I want to help you get to your left leg better, I'm going to straighten my right leg out and tap this right foot off and on the wall easily, about 10 times, keeping pressure down through that left heel and really engaging this left hamstring. Typically, if you were to try the same thing on the right side, you'll find that side's a lot stronger, more engaged, and easier to do, so we don't need to do the right one. This is for left hip bursitis. If we can tuck your tailbone, engage the left hamstring, up and down with your right foot. Feel that hamstring engage. After about 3 sets of 10 repetitions, we should be able to get up and have better mobility of ability to shift your center of gravity over your left hip. That type of a program, along with some other things, could help you get yourself back into an ability where you can walk and get back out and enjoy the sunshine. So try it. If it seems to help you, notice a difference, or you just say, man, that's something I haven't tried before, give us a call. We'd love to see you in and see if we can take care of the hip bursitis. Happy spring.